it's Kristen here at UT Southwestern Medical Center. I'm excited to be here as part of National Multiple Sclerosis Awareness Month with Dr. Benjamin Greenberg. Dr. Greenberg is a physician affiliated with the Peter O'Donnell Jr. Brain Institute as well as Children's Health, and he is internationally recognized for his expertise in autoimmune disorders of the central nervous system. So we're super excited to have Dr. Greenberg. As usual, don't forget to like and share the conversation. We want to spread this as far as we can. And while we can't answer really specific medical questions, we will take as many questions as we can in the next 25 minutes. So start sending them now. So Dr. Greenberg, thank you for joining us.
My pleasure.
So we're going to talk about multiple sclerosis. I know one of the most common questions is, what is multiple sclerosis and are there different types?
Certainly. So broadly speaking, multiple sclerosis is a neurologic condition. What that means is individuals will have changes in their brains, spinal cord, and even the connection between the eye and the brain called the optic nerve. The changes occur because of a confused immune system. So that part of the human body that's supposed to fight off infections, a few rogue elements can get confused and think the brain or the spinal cord or the optic nerve is the foreign invader and go and attack it by mistake. And it can cause a variety of symptoms. If the optic nerve gets affected, you have blurred vision. If the brain or spinal cord gets affected, you might have weakness or numbness, difficulty walking. It all depends on which part gets affected.
Okay, and related to that, you mentioned a couple of the different symptoms. Why is multiple sclerosis so difficult to diagnose?
So as you can imagine, if it can present in any part of the nervous system, it can present with a variety of symptoms. So if you come to a doctor's office one day with numbness in an arm, did you sleep on your arm funny, or do you have an immune system attacking the brain or spinal cord? So it can be difficult in the early stages to make the diagnosis.
Okay, that makes sense. So what is the difference between ALS and MS?
So we get this question a lot because there are a lot of different neurologic conditions that can cause similar symptoms. ALS, or amyotrophic lateral sclerosis, it's easier to say ALS, is a neurodegenerative disease of the motor system. So patients will develop weakness in one or more limbs that progressively gets worse over time, very slowly, affecting more and more muscles.
Okay.
In multiple sclerosis, we don't see, especially in the beginning, the neurodegeneration that we see in ALS, and it affects multiple parts of the nervous system. So you might have vision issues or sensory issues, two things that you never see in ALS.
Okay.
Finally, ALS is a progressive disease that does not have any treatments and is usually fatal. Multiple sclerosis has a whole host of treatments that work exceptionally well and is hardly ever a fatal condition.
Okay, good to know. So we're starting to get questions in. These are great. Keep them coming. Our first one here is from Tony, and the question is, how common is it for an MS sufferer who's been diagnosed as relapsing to never have another flare-up again?
Yeah, that's a great question. So if we look back to the old literature, to multiple sclerosis patients before we had MRIs and before we had treatments, most patients would experience one relapse per year on average. As we moved into the era of better diagnostics, catching people earlier, and the era of therapeutics, we have cut that rate where the majority of our patients have either no relapses on treatment, and we've put them in full remission, or we've dropped the rate to one every 5 or 6 years. And so with the advent of more highly effective therapies, there's a greater percentage of our patients who don't experience relapses at all.
Okay, wow, great question, Tony. Thanks for joining today. So you mentioned, different types of therapies. What are some of the newer therapies that are available to individuals that have been diagnosed with multiple sclerosis?
So the first therapy was approved by the FDA in 1993, and since then we've seen the addition of over a dozen more. And we have 3 categories of therapy. There are some medicines we use by an injectable route, some medicines that are a pill, and some that are an infusion, an IV.
Okay.
On the one category of drugs, which we consider are highly efficacious therapies, the majority of patients will go into remission, where we don't see any evidence of ongoing relapses or changes on the MRIs. And there's multiple to choose from. Some of the infusions are known as ocrelizumab or Ocrevus, alemtuzumab known as Entrada, natalizumab known as Tysabri, and fingolimod known as Gilenya are examples of different drugs where the majority of patients who go on them do great and aren't having ongoing relapses or new symptoms.
That's amazing. Those names of the drugs are quite a mouthful.
Yeah, they are.
So I see some more comments here. I'm just going to read a couple of them. They're mostly comments on you. Let's see.
That can be concerning.
Miss Leslie says Dr. Greenberg is a rock star. So kudos to you. That's really nice, given that.
Appreciate it.
Yeah, especially since, this weekend is Doctor's Day.
It
so
is.
We're getting some love in early. So, one of the things that we've seen in the news a lot lately is, actress Selma Blair recently said, that she's been diagnosed with MS. It does seem to be more common in women.
Mm-hmm.
Is that accurate? And what do we know why?
There's a couple interesting statistics about that. So the first is multiple sclerosis is more common in women than men, and it's a ratio about 3 to 1.
Wow.
So 3 times as many women as men. I'm a neurologist who sees both adults and children with MS, and that statistic of the 3 to 1 ratio only applies post-puberty.
Okay.
If we look pre-puberty, it's about 1 to 1, an equal number. So there is an impact of hormones relative to the immune system in MS that we're still trying to understand. What's concerning and intriguing is if we look at the last 30 years of MS, the incidence, the number of patients being recognized has been steadily increasing. So it used to be it was about 1 in 1,100, then 1 in 1,000, now 1 in 900 to 1 in 800 are diagnosed. But that increase is only occurring in women. We are not seeing the rates increase in men. So it used to be a 2 to 1 ratio of women and men, and now it's up to 3 to 1. Because the incidence is going up in women. We don't fully understand why
there's that next question.
increase. There are theories out there in terms of the environmental factors that are playing a role in confusing the immune system. And one of the theories that has the best data for it is around vitamin D3 deficiency.
Okay.
So as the rates of vitamin D deficiency has steadily been going up in our society over the last 50 years, we think there may be a link between the increased risks of developing autoimmune diseases such as multiple sclerosis.
Interesting. Okay. There you go. It's fascinating topic. It's interesting to see the difference there. So we've got some more questions coming in, and this is one actually question that I had that came in, but how does stress impact multiple sclerosis?
We get this question a lot.
Yeah.
And there's 3 answers. So the first is there a relationship between stress or stressful events and developing multiple sclerosis?
Oh.
And it's actually a hard study to do because we all rate stress differently and we all feel stress differently. You can put 2 people in the exact same situation, one will be stressed, one won't. So how do you quantify stress? There was one study years ago that looked at uniquely stressful situations, probably what I would argue is the most stressful situation. It was parents who've lost a child, which I think everyone would agree is, that's it, that's the ultimate stress.
That's it.
And there was a higher rate of MS relapses in the year after a loss of a child. And even diagnosis of MS. And so we think in the extremes, there's a relationship between stress and the immune system. And as you are highly stressed, the immune system can activate and lead to relapses. When we tried to look at more common everyday stresses, finances, work, relationships, those types of things, we can't find a direct relationship. But we do see patients who have more stress or feeling more stress feel more of the symptoms of MS. So if somebody had a little bit of numbness at the beginning, they tend to have more issues with numbness during stressful episodes than if they're in a relaxed state. So there are a lot of ways they can interact. We tell our patients to try and lead as stress-free a life they can, but there are some things we can't retreat from. We also have to go to work and still have to manage families, and so we can't avoid everything, but we try to manage it.
Okay, good to know. Really great question. Thanks for bringing it up. So what about, we mentioned stress. What about exercise for MS patients? Is that something that they should avoid? Is it something that's absolutely essential?
It's a great question. I'm glad you asked. There is folklore, if you go back 50 years or more, where patients would be told under no circumstances should you be overly active or get overheated. That if you get overheated, you can induce a relapse. Turns out that that's not true. It is perfectly safe to exercise and have an increase in body temperature. Patients may have symptoms, so a hand that used to be numb, as their temperature goes up, the numbness may come back transiently, but then will go back to normal. It's called Uthoff's phenomenon, and it's perfectly safe. What we have found is for our patients who do engage in regular cardiac activity, they have a better course of the condition. They are more functional, longer, less disability, and less symptoms than those who are sedentary. And so having a very active lifestyle is something we encourage.
So are there certain types of exercise? Like would you want to do something like kickboxing over yoga, or does it matter?
Well, me personally, I wouldn't pick yoga at all. I don't look good in the pants. But in terms of my patients, we'll take anything in general, but we do have some favorites. So for us, actually, the number one is swimming. It's a low impact, non-weight bearing, high intensity exercise that gives you a good cardiac workout as well as muscle toning at the same side. Yoga and Pilates are fantastic, working on flexibility and core strength, things that get you moving in general. So if it's something you love and you can do safely, we tell you to do it.
Awesome, sounds great. So here's the question that I know we talked about earlier. This one is from Monica. Monica asks, what about diet?
So, Monica, I wish I knew the exact answer. I will tell you I am 100% certain that diet and nutrition make a massive difference relative to the course of this disease, but I'm also 100% certain I don't know which diet we should be pursuing. We're doing research here at UT Southwestern looking to answer that question, specifically around looking at something called the microbiome. So these are the bacteria that live in our gut, and it turns out which species you have living in your gut, and you have thousands, but which species living in one person's gut may accelerate the course of MS or help put it into remission. And you can modify it, we think, by diet. You can also modify symptoms by diet, but it's probably going to be a different diet for each person depending on what their unique bacterial species are. And so all I can say is stay tuned as we try to decipher this. In the meantime, we do encourage people to explore how nutrition makes them feel, and they have to take 2 or 3 months at a time, cut things out or add things back, and decide what impact it has on their health.
Gotcha. Right. Great question, Monica. Thanks for joining us. So that brings up a topic, we've noticed that, multiple sclerosis, it obviously impacts children. It starts at 18 years old. Does it impact women's childbearing abilities at all?
It's a good question. It does not. So MS has no direct impact on fertility, has no direct impact on risk of pregnancy, and has no direct impact on labor and delivery. And so we tell our patients whatever their family plan was going to be, we will work around that. We do have to manage the medications. And so depending on when women want to become pregnant, we may or may not choose certain medications to manage the MS because we may not want to use them during the actual pregnancy.
Okay, that makes sense. So it's similar to many other conditions out there. You manage around it.
Absolutely.
Okay, good to know. So want to remind everybody, we're about halfway, maybe a little bit more into our chat. So keep these questions coming. They're really great. I know Dr. Greenberg is having a good time here. So, you mentioned that, we don't know about diet, but are there certain foods, to Monica's question, that we know are good for individuals with multiple sclerosis?
So in general, I wish I had the answer, and it's no, it's going to be very personalized. So in general, when we've looked at folks, and this is all anecdotal, we don't have large-scale studies, individuals who are using more of a whole foods diet, less processed foods, less carbohydrates, more fruits, vegetables, lean meats, in general, from what we hear from our patients, are doing better than individuals who have more processed foods and high carbohydrate diets, but it is an individualized thing. We do, at our clinic, have a nutritionist who works with us and works with our patients to try and personalize approaches to diet. And what I remind everybody is to pick a structure, stick with it, and see what impact it has for you.
Okay, sounds great. Good question. We've got one here from Lori, and her question is, what age do symptoms typically start appearing for MS?
So the average age is about 30. There's about 5% of patients who will have their first symptom before the age of 18. And so that's that pediatric MS component. 95% of individuals will be after 18, with the majority at 30 or early 30s.
Okay, great question, Lori. Here's another one from Tony. And this is a little bit more technical, but her question is, if lesions have been found in MRIs of the neck region, does that always lead to mobility issues?
Great question. So when we do MRIs of the neck, we're looking at the spinal cord, the cervical spinal cord, and there are parts of the spinal cord that can be affected that will not impact mobility. Your spinal cord in the back of the spinal cord carries fibers that are only for sensation and balance. So if the plaque, the lesion, the inflammation, all those words mean about the same thing, affects the back of the spinal cord, you may have numbness or tingling or some balance issues, but your motor strength will be preserved.
Okay, so a follow-up to that you mentioned that you see pediatric patients as well as adult patients. Do the symptoms vary between kids and adults that you should watch out for?
In general, no. The same types of symptoms can occur, but kids at onset tend to have a higher frequency of having more than one symptom at once. So when adults present, it's usually one symptom, just blurred vision or just a numb arm or just weakness of a leg. Whereas when kids present, there's a higher frequency of them coming in with two simultaneous symptoms, a numb arm and poor vision. And it has to do with the activity of their immune system. We think that when a child's immune system gets confused, it just throws a party in the brain all at once. It doesn't do it stepwise. And so we see more fulminant presentations. In general, in pediatric MS, our kids have more relapses than adults per year on average, but they recover from those relapses better than the adults do. And so while they're having more activity, their bounce back potential is higher.
Okay. That sounds like many other conditions out there. Kids
yeah.
recover a whole lot quicker than we do.
In general, that is true.
In general. Okay, so we've got another question here from Monica, and she's asking about CBD oil and MMJ. Do either of those help symptoms?
So depending on what's used, we do have patients who have reported benefits from CBD oil. Depending on the state you live in and the access you have relative to different types of products, it makes a difference. One of the things to be aware of is in states where there isn't the regulations in place or the oversight in place, there is a lot of variability in products in terms of what's advertised. And so we caution our patients in states where there is not accessibility for legal reasons, that you never know exactly what you're taking unless you can control for the source. And so you have to be careful. We have seen individuals who were promised that what they were given was CBD oil when in fact there was THC in it as well, and they went for a drug test and tested positive and didn't realize they were being exposed. So I am looking forward to a day when we can delve into this in a little more rigorous fashion, because I think there are going to be patients who benefit from these approaches, but so far we haven't been able to systematically study it.
Gotcha. Okay, great question. Thanks for bringing that up. It's definitely a tricky subject, particularly here in Texas.
It is.
So, why we're looking at multiple sclerosis as a whole, why is early treatment and intervention so important?
What we do in multiple sclerosis is we prevent new damage from occurring. So if I can intervene early and start that prevention early, then a person will lead their life with less residual deficits than if I wait till after the second or third attack. We used to wait until somebody had declared themselves absolutely as having multiple events over time. We don't do that anymore. If you had a single event and your MRI is consistent with multiple sclerosis, and we rule out potential mimics such that we're certain that that's as accurate a diagnosis as we can make, we don't wait to prove it with a second attack. We start therapy early, and in general what we're seeing are better outcomes overall.
Okay, good to know. Great question there. So you mentioned mimicry. What are some of the conditions that are often misdiagnosed, or when somebody receives a diagnosis and it's actually MS?
So there's two different categories. So one category consists of diseases that are other autoimmune conditions that can affect the brain or spinal cord, but they're separate from multiple sclerosis. An example of a condition that we focus on here is something called neuromyelitis optica, or NMO. And it can have a prevalence of about 1 to 2% of multiple sclerosis. And so for every 100 patients who come to the clinic with a label of multiple sclerosis, actually 1 or 2 of them have this other condition. The reason we look for it is it's perfectly treatable, but it gets treated with different medications than the MS drugs, and some of the MS drugs can make this condition worse. So we try to accurately screen for it as early as possible so that we don't make that error.
Gotcha.
The second category, which is the cause of frequent referrals to our clinic, is somebody who gets an MRI for another reason, headaches. Bumping a head at home, a car accident, and somebody orders a brain MRI and says, this looks abnormal, could it be multiple sclerosis? And in that category, the most common cause of a misdiagnosis is probably migraine headaches. So some people with migraines can have small, subtle changes on their MRI that can fool some people into looking like MS, but actually are the result of migraines. And so we spend a lot of time with the imaging to try and sort out, is the pattern on MRI consistent with MS versus not? And it's been a particular focus here at UT. My colleague and partner, Dr. Darren Akuta, has been leading the international charge on new imaging techniques to tell the difference between what is actually an MS lesion in the brain versus one of these mimics. and they've made a lot of strides.
That's a really good lead-in in that, we are an academic medical center, so that means that there's research, education, and clinical care. Are there any research studies, trials that individuals can participate in?
So we're constantly recruiting for a variety of different research studies here, and we separate them into two categories. So one category are interventional studies, where people are coming to us looking for access to new therapeutics to explore. But the other, just as or even more important, are studies to understand the biology of this condition so we can develop new therapies. So we have an ongoing longitudinal study of patients with multiple sclerosis and related conditions, where patients are very generously giving of their data and their blood or their spinal fluid, and it's going into a research lab just across the street, where we're trying to unlock exactly what went wrong in the immune system, so that hopefully one day we can even just prevent this condition altogether.
Wow, that's amazing. Well, for those of you who may be interested in that, we'll post a link to our Study Finder site in the comments field, so if you're interested in pursuing that, you'll be able to access that. So we have a couple more questions, and I know we're running out of time here, but I'm going to take this one from Haley, and it is, do you recommend occupational therapy and physical therapy to help treat multiple sclerosis?
So it's a great question. So we are lucky to have some tremendous colleagues on campus and around the Metroplex who focus on rehabilitation and therapeutics for individuals who've had any type of neurologic injury. And the two groups, occupational therapists and physical therapists, complement each other and approach patients in different ways. If you're somebody who has had any type of deficit in function due to numbness or weakness, where an arm or a leg isn't functioning properly, having an involved occupational physical therapist help teach you how to rehabilitate that function is critical, because what we've learned is even the adults, not just the kids, have incredible plasticity within the nervous system, and we can retrain function. It takes time, and it takes a really good coach. And that's what our physical therapists and occupational therapists are. They are really good coaches on teaching us what should we be doing every day on our own to improve that function. What I remind individuals is you don't get better by going to physical therapy, you get better by doing physical therapy. They are there to teach you how to do it, but it's still up to you to follow those instructions every single day if you're going to get your nervous system to adjust and improve function.
Gotcha. So it's an everyday thing, potentially for the rest of your life, not we're going to go for 6 weeks and then...
They're there to coach you on what you should be doing every day.
Okay, good to know. Great question, Haley. So we are about out of time, so I want to give Dr. Greenberg a chance. This is obviously National Multiple Sclerosis Awareness Month. You have what would you like to say to like our viewers about the future of multiple sclerosis in terms of treatment and everything, really?
Sure. Well, if I had to leave with just 3 messages, the first would be, this is actually a very common condition. There's close to 1 million Americans with multiple sclerosis today, and for everybody on Facebook, if you have a friends list of 900 or bigger, you know somebody with multiple sclerosis. This is a very common condition. The second is it's an extremely treatable condition. We're in a different place than we were 20 years ago in a huge way. The number of options we have to put people into remission are massive, and they work extremely well. And then the final message would be around the research side. I actually think we're getting close to the day where we're going to be able to say we have cured certain proportions of our MS population. The interventions we have available that are working really well for some, not everybody yet, but really well for some, are going to give us the opportunity to look people in the eye and say, this condition isn't a problem for you anymore, and we've gotten rid of it. So that's something we want to spread awareness about, because as we increase the amount of research we're doing and understanding we're doing about these conditions, there'll be a bigger and bigger portion of the MS population. Hopefully we can say we cured it.
I think that's perfect. That's a wrap. So I want to thank you for your time very much. This has been wonderful. As always, to all of our viewers, we will continue to monitor this chat for a couple days. And if you have friends who aren't on Facebook, we're going to share it on YouTube later this afternoon, and that'll be on the UTSW Med channel. So we appreciate your time, all the wonderful questions, and we hope you tune in next time. Have a great day.